Now, the US Senate has opened debate on a resolution to start the repeal of President Obama's legacy-defining healthcare law. Vice President-elect Mike Pence says he expects Congress will come up with a plan for the Affordable Care Act's replacement in the months ahead. Well, we're joined now by Professor of Political Science Peter Mathews, who's in Long Beach in California. He's the author of the recently published book, Dollar Democracy. Good morning to you, Professor Mathews. Thank you for joining us here on Sky News. This has got to be so galling for President Obama, watching what he achieved in spite of Republican resistance at the time about to disappear. Is it likely at all that Obamacare might survive votes in Congress?
I think if it survives, it'll be partial survival. It won't be a full survival because Republicans have the majority and they're using a process called budget reconciliation to actually pass it through this process of getting rid of Obamacare as fast as they can. And the way it works is that the House, or actually the Senate, the key body, the Senate would say to the people there, go ahead and let's pass a resolution, and let's do it through reconciliation, which means that all you have to do is say to the about 4 committees in the Senate, the top committees that are involved with health care legislation, you need to cut out $1 billion from the budget deficit next year. And once that general blueprint is set up, then the specific legislation to implement the blueprint, to actually start the cutting of the budget deficit, will go into place, and it only takes 51 votes if there's a full majority of the whole Senate in place. If 100 senators are there, it's only a majority vote that it takes, not a 60% vote as it would in other cases. So this is a way to reduce the number of votes actually needed to actually pass the various laws that would implement this deficit reduction or implement the cutting of the Obamacare programs. And that's what they're going to be using is a type of a tactic, a legislative tactic to get this done even more quickly. And the deadline they've set is January 27th. To get it done by January 27th. So parts of Obamacare could actually start being eliminated as early as January 27th in terms of the actual passage of the legislation. It's a very interesting way, but they can only do it because they have so many Republicans in the House and Senate, the majority of actually.
Yeah, and the Republicans and indeed the President-elect Donald Trump have all said that they would like to keep some aspects of Obamacare. Which aspects do you think they should keep and why?
Well, I personally think they should keep all of them and then expand on them and make the United States have a comprehensive universal system like all the other countries that are civilized in the world. Britain, for example, you have the NHS, you have single-payer health care in Canada, Medicare for all. We need to have something like that over here, and I think that if they do keep some of those portions of it, they must at least keep the part that says that no insurance company can kick you off the plan just because you have a pre-existing condition. And also that young people who are under the age of 26 can remain on their parents' insurance until they're 26 years old. These are all very incremental steps that Obama took. And in my book, Dollar Democracy, I say in the chapter on healthcare, I call Obamacare a small step in the right direction. It should have been expanded to a public option or a single-payer type of nonprofit medical insurance system, as in Canada, Medicare for all, as we have here for the elderly. That would be the way to go, in my opinion. But seeing Republicans, the majority, and Donald Trump coming in as a Republican president, it's going to be very tough for anyone to get anything done in that direction. So more than likely, we'll start to see some cuts in Obamacare and some real revisions to it. Not entirely, though.
Well, you mentioned the NHS here in the UK. I mean, we're very used to the idea of universal healthcare here. It seems like a no-brainer to us. Why has Obamacare been so controversial in the US?
Because mainly of the lobbyists, the various wealthy lobbying groups that donate money to campaigns to members of Congress to get elected with their money. And then they owe these lobbyists something. The health insurance industry lobbyists, so it used to be the American Medical Association at one time used to be against it, the universal health care. There were lobbyists from the pharmaceutical companies, the drug companies, all these very special interest groups that were able to keep away a concept of universal health care and to vilify it as being socialized medicine. Well, frankly, most of our allies have socialized medicine or some forms of it, as Canada does, and it works very well. Those countries, like Britain and Canada, have longer life expectancy than the United States people itself. We have shorter life expectancy. We have larger rates of infant mortality here in this country than the other countries, and we have other kinds of problems that the outcomes of which are a result of not having universal health care. Even with Obamacare today being implemented, about 20 million Americans are left uncovered. And if the Republicans repeal the entire Obamacare, 20 million Americans who actually receive coverage will lose their coverage as well. So a total of 15 million Americans that should actually be covered fully are only partially covered now, and about 30 more million would lose their coverage entirely. And that's not good at all for anyone. And it'd make all of us, even those of us who have health care, even more in jeopardy of our health when people around us are not healthy. And it's just not a humane thing to do. So that's why I would urge President Donald Trump to go in the other direction and say, look, let's expand it, make it efficient, single-payer, non-profit health insurance, as in Canada, as we have for the elderly here, lower overhead costs, no deductibles, no co-payments, and people will go see the doctor more regularly and get preventive care and live longer. And that would be the way to go for America.
Yeah, indeed. We'll have to wait and see exactly how long it takes and exactly what happens. For now, though, Peter Mathews, great to talk to you. Thank you for joining us here on Sky News.